Mr. Redbutton, and you have a minute, 2.5.
Thank you, Mr. Chairman, and thank you all to the members of this committee for considering medical marijuana with the seriousness of which you have. I'm a radio broadcaster, I'm a marijuana advocate, and I've covered this issue for over a decade. I've interviewed dozens of state and federal legislators, dozens of doctors, and dozens of patients in many of the states that already allow medical marijuana access today. As much as we want to make this a perfect bill, as much as we would like to perfect the language of the Compassionate Use Medical Marijuana Act in New Jersey, I urge you right now to pass the bill this year. And I want you to look at what New Mexico did. Rather than try and define the language right now in this legislation for the alternative care centers, for distribution, for home cultivation, and for the registry card system, what New Mexico did with their bill was include language that left the rules promulgation process to the Department of Health. This is because the Department of Health is going to be overseeing this program anyway. So the rules that we're talking about when you talk about growing at home, when you talk about distribution, when you talk about the registry card system, and even when you talk about the definitions included, were left to the Department of Health and public testimony. New York, Pennsylvania, and Delaware are also considering legislation. Delaware's Senate Health Committee passed forward their bill just this week. Right now in New Jersey, we tell people who want to utilize cannabis therapy, go to jail or move away. That's what we tell people right now. Go to jail or move away. We could wait longer. We could try and perfect this bill further. But then Pennsylvania, New York, or Delaware could have an active medical marijuana program before New Jersey, even though this legislature has considered the bill for over 4 years. So if we keep telling people to move away, they'll just be able to go away one state in the future. And in the meantime, for those of you who may remain immobile on this bill, I hope that you can look these citizens in this room in the eye as you decide to send them to jail. For those of you who sit on the fence and wonder if this is a good idea, I hope that you will recognize that in the year 2009, there has never been a stronger political atmosphere for medical marijuana legislation to pass. For those of you who support this legislation, much like the sponsors, Gusiar and Scutari, champion this legislation. These patients need this bill. People get arrested every single day. We at the Coalition hear from them. So please, don't arrest patients anymore. One thing we understand is that jail is not medicine, but marijuana is medicine in 13 states. Let's allow it here in New Jersey.
Thank you very much.
Thank you.
Thank you.